So where do you do your subcutaneous TRT injections? I'm Dr. Travis Jeffords, Hydro Med Spa, and this is a 1 minute consult. The reality of it is just going to the fat. I mean, I've got people saying all sorts of different things to the comments on where and how and what's best and this and that. I'd say the abdomen is what we do the most of. Most guys, most average guys who are getting on TRT have some form of abdominal fat that you can go into. So majority of the time it's just the abdomen, moving sides, staying away from the belly button, things like that. But the reality is you could do the flanks, you could do kind of the hips area, back of the arm. There's all sorts of different ways. What you have to keep in mind is the volume that you're injecting in the area that you're going. And so if you're only injecting 0.5 mLs or less, then yeah, you can get away with doing it in a few different spots. But if you're injecting a larger volume, then you're going to need a larger area of fat to inject into. Some other things people always ask is, do we go at like a 45-degree angle or do we go straight in? I use a 30-gauge half-inch needle with all my guys, so going straight in is perfectly fine. You don't have to go at a 45. If you're using an 1.5-inch needle, you're using something significantly longer, you're going to have to go likely at a 45-degree angle to make sure you stay in the cutaneous or subcutaneous tissues. So you always have to keep that in mind. But general rule of thumb, abdomen.